So I'd like to read this nonsense letter that it's Racial Equity Rapid Response Team joint statement. This happened after George Floyd, so this was 2020. This had 3 pages of Chicagoland hospitals that signed this letter agreeing with it. Here's just the first page of those hospitals, then I'll read the ridiculous nonsense letter. Access Community Health Network, Advocate Aurora Health, AHS Family Health Center, Alivo Medical Center, Amita Health, Ann and Robert H. Laurie Children's Hospital of Chicago, which is owned by Northwestern, Aunt Martha's Health and Wellness, Chicago Family Health Center, Cook County Health, Erie Family Health Centers, Esperanza Health Centers, Friend Health, Heartland Alliance Health, Howard Brown Health, La Rabida Children's Hospital, Lawndale Christian Health Center, Loretta Hospital, Medical Home Network and MHNACO, Mercy Hospital and Medical Center, UI Health Mile Square, FQHC, Near North Health Service Corporation, New Roseland Community Hospital, North Shore University Health System, Northwestern Medicine, Norwegian American Hospitals, PCC Community Wellness Center, Prime Care Health Community Health Center. That's just the first page. There were 2 other pages listing just the hospitals. Now, the ridiculous letter that really they should have walked back by now, but it's not like the people that are in power or are wealthy ever are held accountable. But they should be. So the Racial Equity Rapid Response Team joint statement, boy, they put a team together so quickly, yes. And again, they put in their racial profiling cameras before this even happened. They're just, I guess they can see into the future and see what's going to happen, huh? It is undeniable racism is a public health crisis. As members and leaders from many of Chicago's healthcare organizations addressing the disproportionate Black and brown mortality from COVID-19 pandemic, we say without hesitation that Black Lives Matter, and Black Lives Matter is in big, bold letters. Very poor decision making of the hospital leaderships to go along with this. They really showed who they are. No person of decency, as if the people that have no decency should talk about decency. No person of decency can look at the images of George Floyd's killing without feelings of rage, horror, shame, and grief. Now, let's just stop here just for a moment. They showed that image over and over again because they wanted to enrage people. They know how to manipulate the public. And they showed just one angle of it, but they failed to tell you that what that officer was doing was in his training manual. However, because we have corrupt everywhere, they took it out of the training manual after all of that. But since then, there's been plenty of whistleblowers in the Minnesota police that have come out and said, no, we were all trained in doing that. If you would have seen the store, when George Floyd was in the convenience store right prior to that, you would have seen he was falling all over the counters and everything. And his autopsy showed he died of a fentanyl overdose. You'd think the hospitals would want to walk this back. But what the hospitals have helped created is a racial war, a racial problem. Because I know Chicago police, okay? I have family members that are Chicago police. And one of them told me that I think it was after one of their officers was shot, or it was a shooting, and they were leaving the hospital, and this was a major hospital, and one of these nurses, some guy, turned around and told the police as they were leaving, try not to kill too many people. And well, one of the officers turned around and said, I could never kill as many as you do. That's the way to stick it to them. Because the hospitals have created this, and they have, indoctrinated into their staff that police are horrible. And really, every single hospital that signed on to this political agenda should have walked it back after the summer of rage that BLM went on. Like setting police cars on fire, setting buildings on fire in cities all summer long. Did the hospitals or those great experts of health not think that those would cause health disparities too? Did that help the Black community, Northwestern? No person of decency can look at the images of George Floyd's killing without feelings of rage, horror, shame, and grief. The deaths of Mr. Floyd, Rayshard Brooks, Breonna Taylor, and too many others are unjust and unconscionable. We must double down on our efforts. Systemic racism is a real threat to the health of our patients, families, and communities. Bullshit. We stand with all of those who have raised their voices to capture the attention of Chicago and the nation with a clear call for action. The health centers and hospitals we represent are deeply woven into the fabric of the communities we serve, live, and work in, and we stand united as frontline staff against racism, injustice, and inaction. Except these are the very racists. They put in facial profiling cameras. The racists do that. Communists do that, and that's who they aligned with, was communism. Communists are always racist. Racism results in generational trauma, poverty, while also unquestionably causing higher rates of illness and death in the Black and brown communities. We have seen its rawest form how the trauma of systemic racism adds to the historical injustices that have disproportionately affected communities of color. Community health centers and Chicagoland hospitals work to provide high-quality, compassionate care in the face of health disparities and poor outcomes resulting from social and economic inequities. No, the poor outcomes are because the hospitals don't want to spend money on the things they should, like staffing. These social determinants of health include poverty, inadequate housing, underperforming schools, police brutality, mass incarceration, food deserts, joblessness, poor access to health care, and violence. Don't you think they really should be saying something to Pritzker then? I mean, we've had nothing but Democrat mayors all this time, and if we're still having these problems in these poor neighborhoods, well, then it's a direct result of the Democrat Party's policies. But of course, Northwestern wouldn't do that. It's not like they'd be honest. All of these factors, and all of these hospitals, and let me not just single Northwestern, everybody that signed this nonsense. All of these factors contribute to health inequities in our communities, and they serve as a recipe for pain, suffering, premature mortality, and understandable civil unrest. Yeah, civil unrest that happened in the summer of 2020, and they supported all that. Think about that. The hospitals supported BLM setting the city on fire. In our communities, there's also resilience, innovation, a tradition of faith, and a spirit of unity that manages to thrive even under the weight of this systemic burden. Imagine the potential for our communities with dramatically improved social and economic conditions and health outcomes. It is time to fully realize this potential. It's time for action. We will work more intentionally with the community-based partners in the building and sustaining the sweeping change that is needed to ensure health equity across the city, and particularly in our most vulnerable neighborhoods, which is why it won't get any better. These people need to be held accountable. As healthcare organizations, we are committed to being part of the solution. No. Both within our organization and in partnership with local community groups. We focus on access to care and eliminating racial bias that contributes to poor health outcomes. Well, then we need to get rid of the racists that are heading up healthcare and all these people pushing racial equity because it's racist. Our society only truly thrives when everyone has an opportunity to succeed and has a healthy life. We are committed, it doesn't even matter, but that last part, our community truly thrives and everyone has, no, our community thrives when we don't have hospital CEOs that are so focused on, stealing money from their own organization that they cut their staff, and that leads to poor outcomes. It's too bad that none of the hospitals in Chicago or the surrounding areas wanted to really be honest, but I don't think I think they've been so full of money, greed, and power that they really don't know what honesty is anymore. They owe every department, every police department in the state of Illinois, most especially Chicago, an apology because they were wrong. George Floyd did not die because of a cop. A cop was doing what he was trained to do, and George Floyd died of a fentanyl overdose. The sooner we start getting honest and stop focusing on China and start focusing on, unfortunately, the most wealthiest and the biggest people in power, which is at our healthcare system and our medical and nursing associations, and we start setting right the disasters they've made, then we can start healing as a community and a nation.